Hello, my name is Madhu Kihalagam and I'm an occupational therapist student in Osteoarthritis University. I'm making this video about osteoarthritis at the base of the thumb. And what I will do is I will give you a brief overview of the condition, and then I will go on to explain some and demonstrate some interventions that occupational therapy provide for people with this condition. So the thumb in our hand is made up of three bones, which are the proximal phalanx, distal phalanx, proximal phalanx, and the metacarpal bone one, which is right here. And the joint we are interested in is made up between the metacarpal bone right here and one of the carpal bones, which are right here. And this joint is called, due to the bones involved, it is called carpometacarpal joint 1, or for short form we call it CMC1. So osteoarthritis is one of the most common forms of arthritis that can be found in human body, and there are many factors that can increase the risk of having this condition. And this condition is most commonly seen in women who are more than 40 years of age, and also which is more prevalent in joints that have been injured or operated prior to this. And so if you talk a bit more about the anatomy of in the bones, so what you can see is where two bones join together, there is a cartilage layer on the surface of each bone, and the purpose of this cartilage layer is to make the movements more smooth. And also this joint, both the ends of the two bones is covered in like a bag of fluid, and we call it a synovial fluid. And this fluid is like in a capsule in there, so it surrounds the joint, and what it does, it provides lubrication for more smoother movements. And so what happens in osteoarthritis is the cartilage layer between on the top of each ends of the bone, it becomes more thin, and at the same time there's the synovial fluid, it starts to produce excess fluid. And when that happens, there is some pain involved, and also there's inflammation. And when this happens, one could normally tend to avoid using this joint. And due to that, what will happen is the strength or the muscles that work across this joint, muscles that work this joint, become weakened, and then that could lead to further problems. And further down the line, like if you come to the prognosis of this condition, a more severe form of osteoarthritis, the cartilage layer becomes so thin that the bones start to grind against each other. And when that happens, there's really bad pain in the joint. And also, if you think about it, when two bones grind against each other for a long period of time, it can start to wear out and it can change shape. And due to this, the joint become really unstable, and also at the same time, it changes shape of the whole structure. So it becomes more problematic. So thinking of symptoms, like how people identify that they have this condition, is firstly it is the pain that have anytime you use this joint, anytime you move this joint, and also reduced grip strength. So some people might find out that they can't hold on to things that as they used to. And also there is joint stiffness, which is usually comes after like a long period of inactivity, like sleeping. And then there is swelling, as I told you before, and the deformity, so the change of the whole structure changes, and then it can cause further problems. Now let's look at some interventions that occupational therapy can provide for people with thumb arthritis. There are different types of interventions. So first one I'd like to talk about is exercises. When you say exercises, one might think why exercise and how exercise helps. So there is research evidence suggesting that doing exercises, like exercising the muscles of the hand, can be really helpful in strengthening the muscles, reducing pain, reducing stiffness, and also helping to maintain the range of movement. So I will demonstrate some simple exercises, and these exercises are related to movements that you would normally do with your thumb when you are engaged in activities in real life, and you might not think that you are moving the thumb in that particular manner. So the first four exercises that I'm going to show you are about maintaining the range of movement, and for these exercises you can aim to do them twice daily, and that's how you can get more benefit from them. So the first exercise is called thumb flexion. So basically what you have to do is keep your thumb like this and move it this way, and this movement is called flexion. And so when you're doing this exercise, you can move it and hold it for 10 seconds like that, and then bring it back to the original position, and then do it again and do this 3 times. Okay, and the next exercise, the second exercise is thumb extension. And thumb extension is the opposite of the flexion, where you move your thumb towards the other side like that. So if you're looking from that angle, if you're looking from this angle, and then moving the other way. This one again, you can move it, hold it for 10 seconds, and then bring it back to the original position, and do this 3 times as well. And the other one is thumb abduction. And abduction means moving the thumb away from the hand. So if I hold my thumb in this hand in this position, I'm moving it towards me. I'm moving the thumb towards this way, away from the hand. And again, hold it for 10 seconds and bring back to the original position, and do this 3 times. And the other one is slightly different. Then now what I like to do is to touch the tip of each finger with the thumb. So like that. Slowly you can do this, and it is recommended that you do this 3 times as well again. Okay, and the next exercise is about strengthening the muscles, and this exercise can be done with the use of a band. So I have a rubber band here, but there are some therapy bands that you can purchase in the market, and they would be much more helpful. So here you can see I put the rubber band over my hand in this manner, and making sure that the movement, this joint can feel the resistance. So that's the resistance is the main point of this exercise. So you're putting resistance on this joint, and by doing that, you're making sure the hand is you're making sure the joint is moving against the resistance. So what you have to do is another 2 simple movements is thumb extension. So you move it like that with the resistance. Now you do it like that, and this exercise you can do it 10 repetitions like that. And the other movement is thumb abduction, as I showed you before, moving the thumb away from the hand in this way, and you can see that you can feel the strain on the joint right here. What is important to notice here is that as I told you, the first 5 exercises, I told you to do them twice daily, but these exercises you should plan to do them about 2 or 3 times a week, because compared to the first 4 exercises, these put much more pressure, much more strain on the muscles here and on the muscles of the hand, and therefore they need some recovery period. So it is important that you do them with some breaks in between. And there are a few other things also to consider when you're doing exercises. And the first thing is pain. So you should not be trying to work against the pain, because that can be harmful to the joint. Therefore, you should always keep your mind on the pain, and make sure that you are you know that it's painful. And also the next one is trying to make sure that you're doing the exercise in the right manner. Otherwise, it can again lead to some other problems. So. And if you continue to have problems with the thumb, always make sure that you consult a hand therapist. Another type of motivation I like to talk about is activity modifications, or using joint protection strategies. So basically, what this involves is finding alternative ways to do certain tasks in a way that it reduces the stress on this joint. Okay, so I will demonstrate some simple modifications that you can adapt to your daily life. And things like, so if you consider holding a mug, I would normally tend to hold it like this with just 2 fingers, or in this way, again putting strain on this joint. So instead of doing this, if it is heavy, what you can do is hold it with your whole hand like this, and then use the palm of the other hand to alleviate the weight, so that reduces the stress on the joint. Okay, that's one thing. And another thing is, like, if you're holding something flat like this book is very heavy. So if you hold it like that, it puts strain on here. Like if you're holding it like this, it puts strain on the joint. And what you can do is instead is to hold the book like this with the palms of both hands, because now you are distributing the weight all over the joints. And another way is also to if you are moving something along a table. So in case like this, if something heavy like this, you're moving from one place to the other, rather than lifting it and moving, you can simply slide it along the table. And this could be an example, be like moving a jar or a kettle in the kitchen. so it again it reduces stress on the joint. And again, one thing important is to just take your time. Don't rush when you're doing things at home, and also make sure to get some help if you need from a family member or a friend. And there are some assistive devices that also you can use at home when you're doing tasks, and those examples are wide grip cutlery, jar twisters, key rotators, and also plug removers. And so all these activities are are where you need to use your thumb in a like more commonly, and also it puts too much stress on the thumb. Again, by using this, you are reducing the chance of the damaging this joint. And another one that occupational therapists are specialized in is splinting. So this is a splint that is made for a person with thumb osteoarthritis. And as you can see, it doesn't really fit me well because it's one I made for someone else. But you can see that it stops the joint, the CNC1 joint, from moving. Yeah, but the other joints are all fine to move. So if you use this when you're doing some activities, again, you are stop that joint from moving. Yeah, and again, if you sometimes it helps with pain, like if you're especially at night when you're sleeping, if you're wearing, there are specialized splints for that. And if you're wearing something, then it stops the joint from moving, as I told you before. So but these things are only given to you by a hand therapist, so you would have to be assessed by a hand therapist, and then they would recommend a splint that is suitable for you, and then they would give you a specific advice about how to use it. So that is the end of my video, and I hope you found it useful. And thank you very much for watching me and joining me today, and I will see you next time. Thank you.